Have you ever wondered why our healthcare system feels more like a wealth care system? Like, why is it that a pill with 20 side effects gets pushed on us, while natural remedies that have worked for centuries get labeled as fake science? Well, it is not an accident. It was actually designed this way by one of the richest men to ever live. Let me show you what happened.
Back in the 1900s, America actually had a huge variety of medical schools. People used herbs, natural remedies, and homeopathy. But then came John D. Rockefeller. He saw a massive business opportunity in synthetic drugs made from petrochemicals. The only problem? You can't patent a plant. So Rockefeller used his massive wealth to fund the 1910 Flexner Report. This report basically trashed every natural medical school in the country, cutting off their funding. At the same time, the American Medical Association stepped in to centralize licensing. If a school didn't teach synthetic, patentable medicine, it was forced to close. And that same corporate control is still alive today. Did you know that under the 1992 Prescription Drug User Fee Act, up to 65% of the FDA's human drug regulatory budget comes directly from the pharmaceutical companies they are supposed to be watching? Because of this, the FDA legally classifies any substance that claims to cure or prevent disease as a drug. Since corporations can't patent a wild plant, they won't spend the millions needed for formal drug approval. If a company sells a highly effective herbal remedy, they are legally banned from telling you it works, even if they have the science to prove it. But here is the real difference between a synthetic drug and a plant. Pharmaceuticals are usually just one single, isolated chemical compound. They are designed to force a single mechanism in your body to change. Sure, that's great for a medical emergency, but for everyday health, it usually brings a ton of toxicity and side effects. Plants work completely different. When you use a whole plant or extract, you ain't just getting one chemical, you're getting hundreds of active compounds like alkaloids, flavonoids, and terpenes. They all work together in what scientists call the entourage effect. It is nature's teamwork. These compounds boost the healing benefits of the main ingredient, while naturally buffering or cancelling out the toxic side effects. It is built-in safety. And don't let anyone tell you this isn't backed by modern science. Rigorous clinical trials have tested these herbs head-to-head against top drugs. Take Berberine, which comes from plants like Gordensil. Studies show it is just as effective as the major diabetes drug metformin at regulating blood sugar. But Berberine also supports healthy cholesterol and doesn't wreck your stomach. Then there's turmeric. Its active compound, curcumin, targets chronic inflammation, which is the root of most diseases. Clinical trials prove high-quality turmeric extracts match the pain-relieving power of synthetic NSAID painkillers for arthritis, but without the risk of stomach ulcers or kidney damage. For mild to moderate depression, huge data analysis show that St. John's Wort is just as effective as standard chemical antidepressants or SSRIs. But patients taking the herb report way fewer side effects like fatigue, weight gain, of feeling emotionally numb. Even simple aged garlic extract has been proven in trials to lower blood pressure and reduce stiff arteries just as well as synthetic blood pressure drugs, while actually boosting your immune system at the same time. Calling these centuries-old botanical remedies unscientific is just marketing. It is about economics, not health. Herbal medicines aren't cheap alternatives. They are incredibly sophisticated, multi-compound chemical factories designed by nature. Rockefeller successfully turned American medicine from a patient-centered system into a highly profitable pharmaceutical-driven machine. Synthetic drugs are absolutely necessary for acute trauma and emergencies, but for chronic health, all plants offer a safer, more balanced path.
Real healthcare progress means breaking free from a century-old corporate monopoly. We need an integrative approach, one that uses modern diagnostics but also embraces the natural, synergistic remedies we've been given. It is time we put human healing above corporate profit. What do you think about this history? Let me know in the comment section. See you in the next video.